The junior doctor's strike leader is no longer a junior doctor and cannot join the picket lines, the Sun can reveal. Dr. Robert Laurenson, co-chair of the BMA's Junior Doctors Committee, was registered as a fully qualified GP this month. It means he cannot join the strikes he calls for, so he will not lose cash in future walkouts, and can now earn at least £70,000 per year in the NHS. Trainee medics go on strike for the 10th time from tomorrow until Wednesday as they demand a 35% pay hike. Dr. Laurenson, 29, has come under fire before for going on holiday during a strike last year, and later saying he would go to work in Canada to earn more money. He was educated at the £46,566 a year private Sevenoaks School in Kent, and is a director at his family's multi-million-pound investments firm. Junior doctors, including GP registrars, in England are paid between £32,398 and £63,152 a year, depending on the level of experience. Fully qualified salaried GPs receive between £68,975 and £104,085 annually, while independent contractors who run their own practices can earn more. The British Medical Association said Dr. Laurenson was a junior doctor when he was elected and will continue to serve as the juniors leader until October. They added Dr. Laurenson will not be working on strike days but refused to confirm if he will be taking paid or unpaid leave. A BMA spokesperson said, Dr. Laurenson is elected to the position of co-chair of Junior Doctors Committee until the end of the 2023-24 session. He is not required to step down immediately because he is a GP, and with the full support of the committee, he will continue as the elected co-chair until the end of this term. The NHS is gearing up to face yet more strike disruption this weekend, which will take the total up to 44 days lost to action since doctors first started walkouts last year. It is the equivalent of 12% of the year. Strikes have cost the health service £3 billion so far and seen 1.4 million appointments cancelled, according to NHS providers. Health service bosses warn the constant industrial action is pushing the NHS to breaking point, especially with winter viruses still rampant on wards. There were 2,208 patients in hospital beds with the flu last week, nearly 4 times as many as the same week last year, NHS figures show. Sir Stephen Powers of NHS England said it's not possible to have 1 in every 10 days affected by strikes for over a year without it having a huge impact on services and patients. The NHS is under huge strain trying to mitigate the impact of these strikes during one of the most difficult times of the year. The latest round of strikes were called after negotiations with ministers broke down earlier this month.